Welcome back. This is Gateway 101. We're going to we have a very, very interesting topic that we're going to be talking about today. Okay? When I say interesting, very, very interesting topic that we're going to be talking about today. Okay? So make sure you stay put. It is very, very interesting topic. Okay? So very interesting. So please stay put because we have a lot to talk today. Wow. Okay. We got a lot to talk today, as I said. So stay put. Okay. Very, very important topic. Okay. So you stay put. We'll try to get started. Try to get started. This is interesting. This is really interesting topic today because let's try to face our electronics. So we'll get our way and make sure you check our YouTube channel because we have a lot of benefit, a lot of things that you can benefit from. Okay, we have a lot of things that you can benefit. We'll be posting video consistently, so we'll expect you to log in and be a part of it. Okay, so log in and join some of this health awareness we'll be creating. Okay, like we always said, whatever we do, it does not constitute diagnosis. Okay, it is simply healthcare awareness. So that all we do, we create healthcare awareness. Okay, so without wasting much time, we're going to dive into today's activity. Okay, so let's get started. Welcome back. This is Gateway 101. In today's live broadcast, we're going to be talking about hemophilia. What is hemophilia and how does it affect people? What are some of the simple home remedy that we can use to alleviate the symptoms? Okay, so without wasting much time, let's get into today's topic. Okay, so feel free to type your questions as we proceed. Okay. Okay, we're talking about hemophilia. I would say that hemophilia is a genetic bleeding disorder. In other words, it is genetics. Okay, it can run on the family line. Okay, where a person's blood does not clot properly. It is a genetics, maybe on the family line. That means your parents might have it, your great parents must have it. So it's a genetics. So it's a bleeding disorder where a person's blood does not properly clot. In other words, a small cord can bleed for a very long time. Okay? Do not forget to subscribe and like. Okay, so this happens because the body is missing or has a very low level of certain clotting factor. In other words, this occurs because the body has a very low level of certain clotting factors. Okay, protein in the blood that help stop bleeding might be compromised. So we're going to be talking about type of hemophilia. I will say that there are two main types of hemophilia. You have hemophilia A and hemophilia B. Hemophilia A caused by a lack of clotting factor 8, while hemophilia B is caused by a lack of clotting factor 9. Hemophilia A is more common than hemophilia B. So what causes hemophilia? Let's dive into it. We are saying that hemophilia is usually inherited, that is, it is genetics, okay, and passed down through family line, like I've just said. Maybe your father have it, your great parents have it, your great grandparents have it, or somebody in the family line have it. So it is genetics. It runs, it is heredited. So it passes down or it runs through the family line or family lineage. It most affected male. Hemophilia almost mostly affected male. Okay. Female can be carrier and sometimes have a mild symptoms. Okay, female can be carrier, but sometimes they have a very mild symptom. So how it affects people? Because the blood does not clot normally, people with hemophilia may bleed longer than usual after cut or injury. So people who have hemophilia tend to bleed longer than usual because the blood does not clot normally. People with hemophilia may bruise easily. Yeah, people with hemophilia may bruise easily. And also people with hemophilia may have frequent nosebleed. So if you're having a nosebleed, please kindly go and check. Go seek some medical help. Okay? But do not forget, we always emphasize in this channel that whatever we say here does not constitute medical diagnosis or treatment. We never diagnose anybody on this channel, and we also never prescribe treatment. All what we are doing in this channel is to create health awareness. We teaches health awareness. We teaches simple home remedy that can help alleviate symptoms. We also give health preventive tips because we strongly believe in Gateway 101 that prevention is better than cure. So let's get that straight. This is no way medical diagnosis or treatment. It is simply a health care awareness teaching. Okay, we are saying that how that hemophilia, how it affects people, and we also said that because we are looking at how it affects people because the blood does not clot normally. People with hemophilia may bruise easily. Because the blood does not clot normally, people with hemophilia may have frequent nosebleed. Because the blood does not clot normally, people with hemophilia may experience bleeding into joint, especially knee, elbow, and ankle. And because the blood does not clot normally, people with hemophilia may have internal bleeding without obvious injury in several cases. So, joint bleeding. Bleeding into the joint can cause pain. Joint bleeding. Bleeding into the joint can cause swelling. Joint bleeding. Bleeding into the joint can cause stiffness. Joint bleeding. Bleeding to the joint can also cause long-term joint damage if untreated. Severity level. Hemophilia can be mild, that is bleeding mainly after surgery or injury. Hemophilia can be moderate, occasionally spontaneous bleeding. Hemophilia can be severe, that frequent bleeding episode, even without injury. Treatment. There is no cure, but it can be managed. There is no cure, but it can be managed. Okay? Clotting factor replacement therapy, regular hemophilia injection is administered. Okay? So, clotting factor replacement therapy is a regular injection that normally given to people with hemophilia disease. Excuse me. Okay? So, newer treatment can also help blood clot better. Okay? Um, Careful injury prevention. It's another way, like also said, prevention is better than, excuse me, better than cure. So be careful, mostly if you know you're having hemophilia. Try to stay away from injury. Okay? Careful injury prevention actually it would go a long way because people with hemophilia tend to bleed easily and bleed for a very long time. So, with proper treatment, many people with hemophilia live long and active life. Okay, so let's look at what are the simple home remedies to help alleviate hemophilia. Remember, there is no cure, but there are simple home remedies that can help alleviate hemophilia. And how can it be prevented? We're going to be looking at that. Okay. First, it is important to be clear. Hemophilia is not something that can be cured or treated with home remedy alone. Okay, it is a serious condition that requires medical care like clotting factor treatment. It is a serious condition that requires medical care like clotting factor treatment. However, there are simple home remedy practices that can help reduce bleeding risk and support overall health. Simple home tip to help manage hemophilia. Remember, this does not constitute medical treatment, but they can help prevent bleeding and complications. Using the RICE method for minor bleed. RICE, R-I-C-E. R will be rest, stop active bleeding immediately. Ice, apply cold pack 10 to 15 minutes. C, completion, gently wrap it safe. And E, elevation, raise the injured area. This can help slow bleeding and reduce swelling. Eating food that support blood health can also be of great value and also it can also help to alleviate bleeding. Why food would not fix clotting factor problem, it help your body stay strong. Okay? Green leaves such as kale and spinach support overall blood health. Food rich in iron, beans, lean meat help prevent anemia from blood loss. Vitamin C food like orange berries support healing. Also practice gentle oral care if you have hemophilia. Use of soft toothbrush. Avoid hard brushing or toothpick. This help prevent gum bleeding. Also choose a safe physical activity if you are a hemophilia patient. Do not engage in vigorous exercises. Okay, good. Walking, swimming, light exercise. Avoid contact sport such as football, boxing, basketball. This any vigorous exercise, soccer, every vigorous exercise should be avoided if you have a hemophilia. Because this project joint from injury and internal bleeding. Treat small cut quickly. So apply firm pressure right away. Don't waste time. Keep the area clean and covered. Okay? So protect joint and body. Wear protective gear, knee pad, helmet if needed. Keep your home free of sharp objects or fall hazard. These are some of the simple home remedies that you can put in place to help alleviate bleeding. Maintain a healthy weight. Extra weight put more pressure on joint, increasing risks of joint bleeding. Can hemophilia be prevented? No, because hemophilia is a genetic. It is usually cannot be prevented. However, there are few important points. Genetic counseling. Family with a history of hemophilia can talk to a doctor before having children. Help understand risk and options. Okay? No, early diagnosis. Knowing early allow proper care and prevent serious complications. Preventing complication, even if you can't prevent hemophilia himself, you can prevent problem by taking prescribed medication regularly, avoid injury, seeing a doctor for unusual bleeding. Important warning: seek medical help immediately if there is severe pain or swelling in the joint. We also encourage you to seek medical help immediately if there is head injury, even if it is minor. We also encourage you to seek medical help immediately if there is unusual heavy bleeding. The bottom line is home care can help reduce risk, but medical treatment is essential for managing hemophilia safely. Okay, so let's look at early warning signs people often miss when they're having a hemophilia. What are the early warning signs that hemophilia patients often miss? Early warning sign people often miss. And also we're going to be looking about food to avoid and also a simple daily routine for someone living with hemophilia. Here is a clear practical guide to help you better manage hemophilia day by day or day to day. Early warning sign people often miss. Some bleeding episodes start quietly, especially internal bleeding. Joint bleeding, very common. Tingling, bubbling, feeling in joint. Warm in the joint before pain start. Mild stiffness or tightness. Don't wait, this can turn into swelling and serious damages. Okay, so if you're having any of these early warning signs, you should seek medical help immediately for proper diagnosis and treatment. Remember, this does not constitute medical diagnosis or treatment. So proper medical treatment is still encouraged. Okay? So muscle bleeding, deep muscle ache, not like normal soreness. A deep muscle ache can be early warning sign of hemophilia. Swelling without injury can also be an early warning sign, and also weakness in a lip, LIMP, lip. Weakness in your lip can also be an early warning sign of hemophilia. Remember, this does not constitute medical diagnosis, so we encourage you to seek proper medical help where you can be diagnosed and treated properly. So, head bleeding, this is an emergency. Persistent headache, it also emergency. Vomiting is also emergency. And uh, dizziness or drowsiness or confusion. Sensitive to light, these are early warning signs. Even a person bulb can be dangerous. Seek help immediately. Okay, this is gateway 101. So settle bleeding sign. So frequent gum bleeding when brushing, nose bleeding that take longer to stop, bruise that appear without remembering injury. Okay, these are some of the early warning signs that most people ignore. Okay, so if you're having this early warning sign, please don't ignore. Okay, seek medical help. Okay, very important. Food and substances to avoid or limit. If you are a hemophilia patient, food does not cure hemophilia, but some things can make bleeding worse. So if you're a hemophilia patient, avoid or be cautious with alcohol. Okay, because this increases bleeding risk and affect the liver. If you are a hemophilia patient, please avoid garlic and ginger in large amount because this can thin blood. Okay, fish oil, omega-3 supplement, high dose may slow clotting. Vitamin E, high dose can increase bleeding risk. Okay, very important to know that avoid medication that thin blood unless your doctor says it is okay, such as aspirin, ibuprofen. Okay, any blood thinner should be avoided unless your doctor recommend otherwise. Okay, because this can worsen bleeding. Okay, simple daily routine for someone living with hemophilia. Morning, gently stretch. Okay, protect joint. Brush teeth with a soft toothbrush and take prescribed treatment. Okay, okay. So this is Gateway 101. Let us look at some other things. Daily, morning routine. Take your prescribed medication if scheduled, and also during the day, eat balanced meal, iron, vitamins, stay hydrated, and choose safe activity like walking, swimming. Okay, this is Gateway 101. Thank you, and thank you so much. Okay.